Everybody. I'm seeing people joining right now, popping into the Zoom room. So we'll go ahead and get started for today's presentation. So welcome. This happens to be our final day of the 21-day reset. This is stocking your natural medicine cabinet. So for the past 20 days, with the 21-day reset, we have provided tools for reconnecting with nature to heal and restore balance for the body, mind, and spirit. So now that you have the resources and information to bring about these lifelong habits, we want to talk today about these practical items to have on hand in your natural medicine cabinet. So to walk us through this topic today, we have Dr. Dixon Thom. And Dr. Thom actually was our kickoff. He presented on January 3rd, our BioBites presentation on natural laws to live by. So it's only fitting that he escorts us out of our reset today. By the way, I'm Jessica Frank. I'm the Biomed Program Manager. I usually forget to introduce myself, so I'll do that now. So I want to say welcome to you all. And Dr. Thom has well over 45 years of medical experience as a clinician and a teacher to doctors, students, and the lay public in proven medical principles, as well as business skills. He is the author of many books, including our Basic Treatment Guidelines, Natural Laws to Live By. In his most recent book, Begin Again, Trauma, Disease, and Healing with the Brain Protocol in Biological Medicine. And that actually just went on sale Friday, I believe. A quick reminder for today's presentation, after Dr. Thom finishes up, we'll have an open Q&A on any topic during our 21-day reset, which could be grounding or earthing or castor oil packs or dry skin brushing, yoga, the lymphatic system. So go ahead and drop questions into our chat today, and we'll keep an eye on those as they come in. And we'll make them part of our Q&A after Dr. Thom presents on stocking your natural medicine cabinet. So please take it away, Dr. Thom.
Okay. Well, welcome everybody. As just said, you have gone through the 21 days. So this is sort of going to be the wrap up, we'll say, of, this is the things that you looked at in detail over the last 20, this being day 21. So we don't have to belabor it. But these are the natural laws that, we've recommended that people add to their everyday routine. So if you want more details about these and a little more detail, I have done a podcast with my daughter over the last 10 months or so. And each of the individual ones have also been talked about in a little more detail than even you got going through each day-to-day aspect of things. So you can find that the podcast pretty much anywhere, but it's on my website as another site. So today we're going to talk about stocking your natural medicine cabinet. So just to comment about that, I often, with my own patients, they'll have a cold, the flu, they'll have this and that. And I say, well, did you do this? And because people are not used to doing things for themselves, they always think, oh, I should ask the doctor. Maybe the doctor knows what's best to do. Hopefully at the end of this little presentation, you'll have an idea that there are things that you can have, and what I will highly recommend that you have available to you. Some of them are really simple. Some of them are like rice water for people who have stomach flu or diarrhea. And, before somebody immediately goes and grabs Imodium, which is the most common prescription for diarrhea, for example, there are just so simple things. You can eat burnt toast, you can drink rice water, which often will do the trick. For people who have a lot of chronic GI upset, just try pumpkin, eating pumpkin in a variety of ways. Historically, a sore throat, colds, flus, wounds, Manuka honey has been used historically. So, you have these types of things that are going on that potentially can prove to be incredibly valuable and incredibly helpful. Vinegar vapor for sinus congestion, in addition to the nebulizing that we had talked about, baking soda, honeysuckle juice on poison ivy. And it's like, whoa, why don't people use this stuff? They don't use it mostly because they don't know about it. So we are going to talk about a few of the types of things that we believe that you could easily have on hand that for emergency type situations in general. And I'm just going to make a comment that is not on one of these slides, but it was something that came up in one of my the workshops that I attended last week. And that's the use of something that is, I would almost bet everybody has presently in their house. And I'm hoping you actually won't buy it when it's gone. And that's acetaminophen, AKA Tylenol. So we have seen recently, because of, COVID uptick, RSV, the flu, there was this hue and cry, oh my God, the pharmacies have run out of acetaminophen. And what are we going to do with our kids if they get a fever? Well, first of all, the hope is that, but doing some of the things we'll talk about today, you won't be using acetaminophen. In fact, by the end of this, I hope you actually never buy acetaminophen again. Acetaminophen, and this is all information that has been available for a long time. We're talking decades. That it's been around since about the 70s. Acetaminophen is the leading cause of acute liver failure in the United States. It causes 4 grams of acetaminophen will cause liver failure within 24 hours. And if you drink alcohol, that's 2 grams. The 2 grams is simply 500 milligram tablets. And people are often taking 2 of these, every 4 to 6 hours. It would be easily to do that. And so literally acute liver failure within 1 day of doing that. Unfortunately, acetaminophen is found in over 600 products, over 600 prescription and over the counter. And there's a couple of things we'll talk about. The N-acetylcysteine and green tea is what is used in the conventional community to treat acetaminophen poisoning, which is like, wow, they're using natural products, but they don't tell you about them for something that basically that's over the counter that's so easily managed. This may be a little bit out there that, and I'm not wish to create conspiracy theories, but there was a recent publication in October 2022, so 3 months ago, that basically has shown that, while I just talked about liver failure, the main target of acetaminophen and Tylenol is the brain. And the research has shown that in children, it dramatically alters brain development. And since the brain doesn't fully develop until the mid-20s, my suggestion is nobody under 25 should ever take Tylenol because it can have a dramatic impact on that. And if you're over 25, you should take nowhere near 2 or 4 grams of which is not a lot of pills in general. Unfortunately, there's also the research in that came out a few months ago that has shown that even Tylenol taken by a pregnant mother will alter the neural development of the fetus for what's going on. And how do you protect against that type of toxicity? It's with glutathione, which is a natural immunity. And it's the thing we've suggested that you put in your nebulizer for what's going on. Despite the aspect that this information is not new, the College of Obstetrics and Gynecology still have not come out and said, yes, children, pregnant moms should not be using Tylenol. So I'm here to tell you, you should not be using Tylenol. And in fact, there's other choices. There's a lot of things that we're going to talk about, including those things that are on the screen there. Chemotherapy is an herbal, these are herbal medicines that have been used historically for certainly the last 100+ years. And the greatest thing about these is these are safe. If you drank the whole bottle, would it be too much? Yeah, probably, because you don't need to do that. But ribes nigrum is one of the remedies made from basically blackcurrant buds that are great for fatigue and low stamina. Ficus carica, which is made from figs, is for the nervous system, is for digestive upset, is for irritable bowel. From the linden tree, we have Tilia tomentosa, probably one of the most important remedies for the nervous system. Somebody who has anxiety, depression, ADD, ADHD, any type of nerve irritation. Acer campestre is from the maple tree, also anticipatory anxiety. And then rosemary from the great smelling rosemary plant is great for allergies. It's great for digestive problems. It's great for endocrine problems. And yes, it's helpful if you have a guidance from a practitioner or an herbalist who is familiar with these. But the reality is you could have these in your medicine cabinet to take if you have a digestive problem or if you need a little more stamina, that type of thing. Most of you will be familiar with classical homeopathy or single pellet homeopathy. The remedy that I have there, Arnica montana, is probably one of the best known remedies. It's without any doubt, it should be a remedy that everybody has. It's the #1 remedy for, I'll say, acute injury, sprains and strains and bruising and that type of thing, that it's easy to take. And it's almost impossible to overdose a homeopathic remedy. These are, some of the more common ones that we see that are available. Aconite is a sudden onset of high fever. It's also for sudden shock. It's for anxiety, and and I always suggest that in your medicine cabinet you're going to have a low strength of these, maybe a 6C strength or a 12C strength, even a 30C strength. And as you going back a slide, they're in little pellets. 3 pellets is typically all you need for a dose to take, and you put them under your tongue and you let them dissolve. Allium cepa is basically like onion and garlic, and it's for when your nose burns and you have a cold and it's acrid, that type of thing. Apis is for bee stings, and so if you had a bee sting, you know how it feels. It's burning, it's hot, it's stinging. The perfect remedy for that is to give homeopathic apis, homeopathic bee sting. Arnica, I just mentioned, is for trauma. Arsenicum album is probably the #1 remedy for food poisoning. It's a great remedy in pregnancy for women who have nausea of pregnancy and can't bear the sight and smell of food. Belladonna is, I would say, is something that you could consider for if your child has a fever, which is a good thing per se. And once again, we just said, don't give them Tylenol because you potentially have a pretty high risk of creating a problem in general. And, just another thought about that, there has been a lot of disagreement that the MMR vaccine will say and autism is a problem because of mercury. But very often what happens, and they often have found, especially in children who are autistic, that after vaccines, what does the parent give it? They give the child Tylenol. And it's the Tylenol that probably is doing the problem more so than it is the vaccine. So it definitely is not a good thing to have in your medicine cabinet, in my opinion. Calendula is an ointment. It's a plant, of course. It can be applied locally to burns and cuts, open wounds. Certainly a very healing type thing. Bladder infections, urinary tract infections, where there's burning before, during, and after urination. Cantharis is probably the #1 remedy in that specific aspect. Now, there's homeopathy, of course, is usually individually prescribed. However, you take the remedy, if you feel, well, that didn't do anything, it's probably because it's not the right remedy. So I'm just giving you very general, very generic type suggestions and recommendations. And if nothing else, they'll do nothing. But in the best scenario, they'll actually be extremely helpful. Ledum is for insect bites. It's for stepping on a rusty nail. It's for puncture wounds, that type of thing. Nux vomica is probably the #1 remedy for New Year's Eve, Christmas celebrations, that type of thing. Just the proverbial hangover remedy. Rus tox, which is basically made from poison ivy, poison sumac, is for rashes that can look like that, but it's the key thing about that is the itching and the arthritis that goes with a lot of pain that's associated with the musculoskeletal system. Rus tox is a great remedy. If you have a splinter that basically is incredibly uncomfortable, silica is the #1 homeopathic remedy in that regard. So there, and you can actually purchase, first aid books in homeopathics. You can get a homeopathic kit that maybe has 10 or 15 of the most common remedies that I've just mentioned. There are 12 cell salts that also have a lot of effectiveness in a whole variety of different types of problems. These are great for kids with a whole host of, nature of issues that children will ultimately experience. Anybody who has sort of chronic spasms, and whether it's menstrual cramps or whether it's Charlie horses or whether you get a stitch, so-called, after doing some form of exercise, Magphos is always a tissue salt that has proven to be incredibly effective for that type of thing. Nat mur, which is literally made from table salt, is for any type of edema. It's a great remedy for nervous system problems also, because it affects the lymphatic system, which you heard about in the 21-day reset. It's a strong antihistamine, therefore it can be used for allergies. So these things are obviously all over the counter. And tissue salts come in usually a 3x or a 6x, sometimes a 12x strength. You can go in the middle and just buy a 6x strength of these types of things. And you can find information about these in addition to what's on the slide there. And the whole idea is just try them. Just take these and try them, and you'll be pleasantly surprised, if you've never used them, how effective they can be for emergency type problems. Many of you are probably familiar with flower essences, specifically in this case, Rescue Remedy. Rescue Remedy is made up of 5 different plants that have been formulated into that particular product. Some of you, if you've gone to a biological dentist, for a variety of things, they may say, would you like some Rescue Remedy before we do a specific procedure? So it's and people often think that flower essences are mostly for emotional, upset, grief, etc. However, they're just as effective for any type of a physical ailment as they are an emotional ailment that people will experience. They're easy to take. You take a few drops. You can take it many times a day, depending on what the specific remedy is. And these are just different remedies. Again, these are different flowers, if you like, that are made into different remedies. Mimulus, for example, is a very common remedy that's used in depression and sadness and that type of thing. Wild oat is a flower essence that's used for people who are trying to find their place, kind of find their purpose, trying to find what should I do with my life, that type of thing. So the remedies have an incredible amount of effectiveness, and so aspen, anxiety for no known reason. And the thing is with flower essences, you can mix and match them. You can put. Very often I'll put 4 in a combination, depending on what it is that we're trying to treat. Cherry plum for weight loss. Wild oat, as I said a minute ago, is for the whole idea of finding what is it that you want to do? What life direction do you want? Just I can't deal with it. No motivation. Hornbeam may be something that one would consider. Fillory is the person who is picking on other people, and it's like, well, you may not realize that you're doing that, but these are the types of things. And there's Bach flower has 38 different remedies, but there's many other companies that also make flower essences. I mostly use the California essences here in this part of the Western US, and there's probably there, if you had the Bach flower remedies, we can easily have 75 or so different remedies that are available for people to utilize for a whole variety of different types of things. There is also a number of topical type things that are useful, and not only to be used for once again a variety of things. So aloe vera is one of the best things that you can, taking the aloe vera plant, breaking it off and literally expressing the gel and putting it directly on the skin is very soothing for sunburn or scalds or burns. that type of thing. Witch hazel is going to be for bug bites. Ginger notoriously has been used as an antibiotic. It's anti-nausea. People will take it routinely. Ginger, you can get it in capsules, you can get it in chews, a variety of different types of things. Clove oil is pain relief. It's been used for toothaches historically forever. Chamomile tea is, for just soothing, on a stomach upset or minor rash. Gas and bloating. Activated charcoal works in a slurry. You just drink it. Turmeric is well known now because it's used for all kinds of inflammation. Chili pepper has capsaicin, which is basically you can be used topically for sore muscles. All types of mushrooms are very helpful for immune support. People are now using them routinely. Putting eucalyptus oil under the nose, basically for inhalation, for sinus type problems or colds. Mint is helpful for pain relief. Fenugreek will increase for breastfeeding moms, will increase milk supply, but it's also helpful for blood sugar and the aspect of diarrhea. Yarrow is, these are all, these are common plants, easy to get. Cut, scrapes, bleeding. Plantain again is another one for bee stings in addition to apis. Comfrey is for all kinds of wounds. I remember many years ago I was in Fiji, and we were being shown around by a guide, and there was all kinds of comfrey grown. He says, "Yeah, what we do here, because we don't have a lot of physicians," he said, if somebody has an injury like playing soccer or something, they just literally go in next beside the field, they'll cut some comfrey leaves, tape it around the injury, and the person just keeps playing. It's pretty amazingly effective to use these types of things. Most people are familiar with echinacea because it has been used for immune support forever, and is commonly used in all kinds of herbal types of things. So a couple of years ago, these are the top 40 herbal products that were sold basically in the United States, including green tea. Green tea is a great alternative for many people who have decided that they don't want to drink coffee, et cetera. So there's a lot of healing properties that ultimately come with green tea. There are common herbal products for arthritis, for nervous system problems, for colds and flus. As we said, saw palmetto is commonly recommended for men with prostate issues. Cohosh and soy and primrose for women with menstrual things, and then ginkgo and garlic for circulation type problems. And so, once again, echinacea, we said, saw palmetto for BPH, ginkgo for circulation. Ginkgo is now a common one for memory, cognitive decline, brain fog, that type of thing. The ginkgo tree is, when I lived in Portland, there was ginkgo trees almost in every park, and people would collect the leaves and make their own ginkgo preparations. Ginger is common for most people for nausea. So, these are the type, urinary tract. Many women are now familiar that drinking pure cranberry juice, if there's a urinary tract infection, is something that can be particularly helpful. And the list goes on and on and on and on. And why? Because herbal products have literally been used, I'll say, back as far as the Egyptians, because with mummies, they have found a lot of herbal products were associated with the whole mummification process. So they knew about frankincense, they knew about myrrh, if we look at the time of Christ. So these products have been around for thousands of years, even before that period of time. Green tea, I mentioned, is a particularly good thing to have, not only in your medicine cabinet, but just in general. A lot of people benefit from drinking green tea from a healthy perspective, because it does help immunity, reduces cholesterol, helps hangovers like Baclomica does, circulations. So these types of things are, incredibly common, incredibly helpful. One of the things that, is probably becoming more evident is the importance of chakras. And of course, we have the colors here that are associated with the chakra points. And, what are chakras? So, we consider chakras these non-tangible energy centers that are really the component of blocked, sometimes spiritual entities, certainly emotional entities. And it's definitely believed in the alternative aspect of medicine that these different chakras actually will remember different events and different traumas that will affect us throughout our lifetime. And there are specific type of emotional memories that ultimately get stored in each of these. And as Jessica mentioned, I literally just as of last Friday finally finished, and my book is now for sale. And chakras becomes a part of ultimately dealing with past trauma. And there's a variety of different ways that we can do that. Looking at each of the different chakras and using lights, for example, would be one of the ways to do that. Often energy is blocked at a specific chakra, and that may be the weakest link as far as your own specific health concerns are. And in the book where I describe how we deal with trauma, one of the things we do as one goes through each of the different phases of our development is to use the different colors every day, just as the chakra colors are. So chakras, gemstones, musical notes, fragrances, psychological functions, organs are all ultimately affected and have been shown to be effective for literally, decades and decades, if not centuries. So we do know that there are essential oils that are also very effective for the different chakras. And when a chakra is blocked, people often will experience a negative physical, emotional, or spiritual symptom, but not knowing why they're having that particular symptom. One of the most simple behaviors that you can do, I'm going to go back a couple of slides to the picture, is, we saw in the 21-day reset the whole idea of the importance of breathing and breath work and deep breathing, which is commonly done. And the whole idea of yoga is as much about breath work as it is about the actual poses. But what I've found with patients is that as you're taking a deep breath, if you visualize the colors that they're there on the chakra colors, if you visualize with your eyes closed, usually, that you're breathing in, let's say the root chakra, the color red. And so with each breath, envision that the air, the color red, is going to every part of your body. And then, when you feel that every part of your body in your mind's eye is red, you start to breathe it out. And ultimately, what should happen, it'll dissipate, except at that root chakra. Now, what people will find, if that chakra is blocked, people are not able to concentrate the red color to the specific point on the chakra. And I'll go back to the very first picture to that. So we want the colors to be able to associate at the chakra point. And it's an easy way for people to themselves figure out which of my chakras is blocked. And when you understand chakra and the importance of that, it's an easy, then we can start looking at different, music sounds, music notes, different colors, et cetera, different aromatherapy that are basically can be used, that are applied topically over the chakra points, specifically to balance that. And these are just, some of the ones that have been used effectively for the root, sacrum, the solar plexus, the heart, the throat, the third eye, and the crown chakra. So here's your 7 chakras. And these are just a variety of different types of essential oils that can be applied topically if you find that that's one of the areas that are blocked. Just make a comment also about the throat chakra. And, the people often ask, why is it that women seem to have more thyroid disease than men? And one of the main reasons is because women tend to have their thyroid gland exposed. Their clothes basically exposes their thyroid gland. It's more sensitive to the outside world and in general. And then when they look in third world countries, let's say the Middle East, where women often are totally covered up, there actually is less thyroid disease, short of not having iodine deficiency, which is a problem. And so you can use the colors, you can use the different colors. And so very often when thyroid disease, I just recommend women basically, use a blue scarf, and they wear a blue scarf over their thyroid, which can ultimately help heal part of the healing process that's going on. These are other types of essential oils that we mentioned, the eucalyptus oil for sinus type things. Lemon is commonly known. Lemon is a great one for headaches. Also, oregano oil is, we have cinnamon is blood sugar type thing. So they all have different types of importance and different types of purposes for what's going on. The emotional freedom technique is really about tapping. People who are familiar with, tapping these different types of points, which you basically are easily exposed, from the collarbone on the chin and under the nose and the eyebrow, etc. And very often when people are in a challenging situation, when stress levels are high, they may be feeling their heart starting to really beat, they're having palpitations, they're getting overwhelmed, or maybe they're feeling lightheaded. Literally by learning the points of tapping, it's can happen very quickly. You can do it yourself. You don't need any tools other than your finger to basically tap on the different points. And it can be a very effective in an true emergency situation to be part of the calming. You add that with some deep breathing, you add that with some of the so we just talked about, it becomes very effective in being able to do that. And doing the 21-day reset, we basically, you saw a couple of the different types of things that I think are particularly helpful and are useful for the entire family. And the use of taking, vitamins, right now, and just this morning, I heard them say that, oh no, you don't need to take vitamins because if you eat enough different fruits and vegetables, you'll get all the nutrients, which maybe if a person is 100% healthy, that's true. But they don't come to my practice, let's put it that way. And this was published, as you see, in 1936. So it's been around for a long time that, vitamins are important, but the biggest common deficiency there is in this country is not so much vitamins, it's actually minerals. And lacking minerals, the vitamins don't do much of anything. So I look at the so-called research that I just saw this morning on television saying, oh no, taking 1,000 milligrams of vitamin C really doesn't change. Maybe there's a 10% improvement for a cold and a flu. But without reading the research, I would say, but are they lacking any minerals? And if you're lacking minerals, the vitamins won't do as much. So ultimately, as Linus Pauling said, you can pretty much trace every element to mineral deficiencies. So it goes without saying that, we have a variety of different nutrients that I think are helpful for everyone. From probiotics, the microbiome now is well known, to be part of a lot of health problems. Omega-3 fatty acids, eating fish or flax or perilla or evening primrose are ways to ultimately get those in. I put B vitamins in. B vitamins are the catalyst because it seems that many patients that I see, it's always about energy or lack of energy. And in order to make, the energy packets in our cells, in our mitochondria called ATP, the thing that actually is the catalyst for each of the functions there are actually B vitamins. And yes, if you eat plenty of greens, you will get those, which is always encouraged. But because of stress, it's also, we call it a stress vitamin. And then, as I said, minerals ultimately become the most important. And as you look at plants themselves, plants also need minerals. And you see the different nutrients that are required for plants at different stages of their growth. And we're not any different. As we grow from the moment of gestation until we pass away from this earth, at different times, different nutrients are important, but having a deficiency of even one mineral can be catastrophic as far as health problems are concerned. Very often, I recommend minerals in the form of liquids, colloidal minerals or trace minerals. If we're eating a good variety diet-wise for what's going on, but I do that as extra support. So we know these micronutrients are required by humans and all that kind of thing, and they literally are the catalysts that allow every function in your body to be highly effective. So the 21 days is done, but actually it's not done because it's never done. We're always basically looking forward to, continuing the things that you basically did over the last 21 days. The more that you're able to incorporate those, into your everyday, we'll say, let the reset continue, because they're everyday things. We call them natural laws. You can't basically do things for 21 days and, whether we do this again next January, a year from now, it's like, well, it's between now and then that will ultimately make the biggest difference as far as your health is concerned. So we'll take the opportunity to basically, you can ask, hopefully I'll be able to answer it, anything that's you've read or was of interest in the last 21 days. And once again, this is basically informational purposes that we give this. I'm not giving you specific advice, but there's information available. It's easily available of some of the types of things that you could have or at home in your at-home medicine cabinet that can be really lifesavers in many cases, as opposed to thinking that you'll have to find a physician to sort it out. Not that they're not needed, because they definitely are. And just as a reminder, what Jess said, if you're interested in looking at my book, you can look on the website, drdixonthom.com. If you're interested in trying to appreciate how much effect trauma has on your specific life, that book was written over the last 4 years with hundreds and hundreds of patient interventions, because I've been doing this work for the last 20 plus years. All right, now I can stop talking, and now Jessica will start talking.
Thanks, Dr. Thom. So, and I think you're still sharing your screen for a second.
You want me to
do
that?
Okay. Yeah, go ahead with that. Thank you so much. Awesome. Yeah, that was obviously, as usual, a ton of information, so all valuable. And I want to remind everybody that this is being recorded, as well as you'll be able to get those slides. So I hope you weren't taking copious notes and furiously writing down everything, because the slides will be available to you, and we'll send that out in tomorrow's resource email that's going to go out in the morning. You'll have everything collected there for you. All right, so I just want to acknowledge a comment that was made in the chat before we head into questions, and that's from Carla. She said that she grew up in the Azorian Islands. My parents always had home remedies, and I remember always having tea when I was sick, from fennel to mint teas. And the first time I had Tylenol, she says, was as a young adult in this country. So just to your point earlier in the program, when you were mentioning the Tylenol and acetaminophen. So, all right. So one question that we have here is kind of circling back to day 4 with water. So drinking water. What is your opinion in the interest in alkalized water, or ingesting alkalized water? So this is a 2-part. Number 1, what's your opinion of interest in alkalized water, and also carbonation? We have these soda streams and things that make carbonation in water, or buying a lot of carbonated water. What is that to be avoided? What's your opinion on those 2 things?
So I think my opinion first about the alkaline water one. I mean, people typically drink alkaline water because historically it's well known that chronic illness is more often associated with acidity, and our tissues are more acidic, our cells don't function as well. So the idea is, well, if we have alkaline water, meaning basically it's below a pH of 7.2, which is sort of basic or neutral. that somehow it'll change our cells. The reality is it won't. Every tissue in the body is at a different pH. I mean, if you drink alkaline water, our stomach is about a pH of 1 to 2, ideally, for acidity. So drinking alkaline water in the long term doesn't change much of anything. The most important thing with water is to drink it, period. And yes, there's many varieties. The goal is that minimally there's some form of a filter on it. Once it comes out of the tap, we don't need the chlorine and a bunch of other stuff that's in there. And so whether it's as inexpensive as a Brita filter, which is not the ideal, but it's better than not having anything, to reverse osmosis and other types of water filtration systems that are available. And there are many that are available, per se. Start with something that seems affordable, but more importantly, drink water. If people want to drink alkaline water, fine, but don't do it with the idea that this is the one thing that's going to make the dramatic difference, in my opinion. The question about carbonated water, carbonated water tastes good, people like it. And since most of the time the suggestion is that we do not drink with meals, minimum ideally 15 minutes before to 30 minutes after. The worst time to drink a carbonated beverage would be during meal times, whether it's a soda or one of the things that people have because it tastes good. The whole idea is of water and input is between meals. And so if you want to drink some type of a carbonated beverage because it tastes good, I don't have a problem with it. I do have a problem with it with people drinking it during mealtime.
Okay. Understood. So better to be filtered than alkalized, and probably to watch your intake of carbonation. Okay, cool. I have a question here about minerals. So circling back down to minerals, which are the primary minerals that should be taken regularly that we know we're depleted in, that minerals, we need to make sure we get at least those?
I think that's the fallacy. The fallacy is that, there's, what do we have? We have the macronutrients, the macro minerals, and then you have all these micro minerals. And I don't have a slide in this presentation, but I have a slide that actually shows the proportion of minerals throughout the body. And, people think about, oh, that means it's calcium. Oh, that means it's magnesium. Oh, that means it's zinc, the iron, which are the big ones per se. But the reality is you need vanadium as much as you need magnesium. You need, cobalt for vitamin B, that type of thing. So you really can't be deficient in any mineral. And the research has shown that at least 80%, if probably higher, the US population is deficient in at least one mineral. So the best thing to do is to do something that's multi-mineral. And it's not, well, I'll just take the macro minerals and that'll solve the problem. No, you actually just as equally need the micro minerals, which are all these, if you look in seawater, they say there's 75 or 80 minerals in seawater. So that's why using things like sea salt, Himalayan salt, Celtic salt, as opposed to table salt, which is just iodine added. It's sodium, potassium, sodium chloride with some iodine added. Well, that's 3, but sea salt has like 75 more. So when we're looking at food per se and a way of getting it in, that's the side of salts you're getting, because you will be getting those micronutrients and essentials. So if you're cooking and using salt, please don't use regular table salt. Use Celtic, Himalayan, sea salt would be much preferred.
Okay. Wow, that's interesting. Okay, we're going to bounce around some more. Going over to, let's see, day 10, dry skin brushing. Can you please go into a little bit more detail on the direction of the lymphatic drainage and direction of dry skin brushing, and why at night?
Yeah, dry skin brushing is something that, well, say started off and, it's been used forever, of course. And, the video that was on the reset basically suggested that you do it in the shower. And, the demonstration that was being done is showing a pretty brisk, brush. And so if you want to basically debride the skin, that's the perfect way to do it, is the perfect time to do it. However, from a health perspective, the way I suggest it is not to do that, is actually you do it at nighttime. And you do it at nighttime, and you do it with a sponge or a loofah, and you do it with incredibly light touch. So light, in fact, that if you were to close your eyes, it would almost feel like there's a feather touching you. Because if you use a heavier brush, you actually are compressing the very tissue that we're trying to support, which is your lymphatic system. We know that the lymphatic system is most active during the night. It's the time when literally, I'll say, our cells are trying to heal. It's the opportunity that our cells, we say, are dumping their toxic waste into the lymph system, ultimately to be taken to our primary emunctories, which is our colon, our bladder, our lung, our skin, and our brain. And so the lymph system is responsible more than the cardiovascular system for allowing the cells to cleanse themselves. And so the reason we do dry skin brushing with a very, very light touch, moving literally from the feet up the legs, up the chest, up the arms, up to the neck, and it all dumps into what we call the thoracic, right up here, the thoracic duct, which is just we'll say under the collarbone on the left side. That ultimately dumps back into the cardiovascular system, which ultimately starts to circulate it through these different organs for what's going on. And so when you, from the collarbone, you come down, and everywhere else you come up your arms, you come up your legs, you come up your torso. And if you can reach your back, you basically, everything is moving, because we're trying to get it towards this thoracic duct, which is where the lymphatic system basically ends. So the key aspect of dry skin brushing, from my perspective, is lymphatic support. It's another lymphatic treatment, just like doing castor oil. And so the reason that ideally castor oil and lymph are done in the evening is because we're about to prepare the lymphatic system to do most of its work, to get it moving. It's like priming a pump in an old farmhouse. You have a well and you pump and no water comes up, you pour a little bit in, you pump a little bit, pour a little water in. And then once it starts to go, it just keeps flowing. The whole idea of the castor oil and the dry skin brushing is to prime that pump, so that when we go to sleep, and we're sleeping for ideally 7.5 to 8.5 hours, the lymphatic system has the opportunity to truly cleanse. And that's why typically in the morning, your urine is the strongest. In the Chinese clock, a bowel movement happens between 5 and 7 a.m. And our breath is the strongest, because we've dumped all this waste product into our emunctories and basically allowed the body to get rid of it as we start a new day.
Wow, that was great. Wow, that really separated what I was thinking before about the dry skin brushing being something, aesthetically that we
Right.
can do. It's really for a health practice, so that's more beneficial for our bodies. Great. So we have another question. What is the explanation of why/how tapping works? So EFT, is it related to Chinese medicine, as in the Chinese meridians?
What we're ultimately trying to do is literally reset. I'm going to say reset your vagus nerve. Your vagus nerve is your parasympathetic nerve. It's the nerve that literally goes from our head all the way down into our pelvis, per se, and innervates everything in between. And so the vagus nerve being this rest and relax parasympathetic component, when we're doing that, we're literally trying to reset, different aspects of the vagus nerve. That's how I think about it. That's why I think it's helpful. And I'll call it these emergency situations when people are in high stress, or, the deep breathing isn't quite enough. And if you add tapping into that, and just another way, and of course, there's multiple other ways to help the vagus nerve also. But that's one of the things. And I think that's why it's as effective as it is. Anything that you can do, splash cold water on your face, hum, sing, gargle, those types of things are all things which will also support vagus nerve treatment. And when somebody is really hyped up, that typically would be one of the more effective ways of doing it. And tapping is just another way. And of a number of patients who use it fairly routinely when they're in a so-called stressful situation.
Awesome. Thank you for clarifying. One more question, or another question I have here is, it's hard to discern at times how much to take of something, and then maybe apple cider vinegar on a daily basis, or maybe the mushrooms or adaptogens on a daily basis. But what would be kind of, to borrow the term, an RDA, a recommended daily allowance, to get the benefits of something like apple cider vinegar? There's never any kind of, it's all kind of splashes here and maybe a teaspoon there. And but how much do we need to actually benefit the body on daily, like kind of on a daily basis, if you could speak to something like that?
Well, for apple cider vinegar specifically, my typical recommendation is to put a half to 1 teaspoon of apple cider vinegar in a glass of water, and ideally you drink that 15 to 20 minutes before meals. And there's possibly a misnomer as what people think it's doing. What we're not doing is we're not suddenly acidifying the stomach so that, you know, it'll properly digest protein foods that need more acid than carbohydrates do. What it ultimately has done, and what it's training the body to do, is to get the release of a hormone called CCK, cholecystokinin. Cholecystokinin is normally released when you smell food cooking, you know, when you start to salivate. And if you think back to Pavlov's dogs experiment that he did, basically, you know, before he would feed them, he rang a bell per se, and then he would feed them. And after he did that for a while, he would without feeding, he would ring the bell, and the dogs would start to salivate. So what I have found in practice is, if people, when they basically take apple cider vinegar and what they're doing, and they're saying, okay, what I'm doing is I'm stimulating this hormone CCK. It'll increase your stomach acid, it'll increase your pancreatic enzymes, it'll increase bile flow, basically to be able to digest whatever the meal is that you're going to do that. And we'll say it's a 10 or 15-minute process. And that's why, if, you know, when you go through a drive-through restaurant per se, and you basically you don't have the opportunity to smell anything, you probably are not stimulating that particular hormone. So you really don't get a lot of benefit out of the meal. That's why we say, you know, one of the most important things when we eat is to eat in a relaxed state. Don't be talking about stressful things. Don't be watching something on television. You know, you'd be a lot better off. You know, the whole idea of romantic evening, you know, a glass of wine, nice music, that type of thing. It basically is putting you into this parasympathetic state. I think of apple cider vinegar as supporting that. And I found people who do consistently for about 3 months never again have to take the apple cider vinegar, because all they have to do is think about it, and they'll get the same reaction that Pavlov's dogs did. And you'll get the release of the CCK, and you'll never have to worry about heartburn. We have the Super Bowl coming up in a couple of weeks, and they'll advertise it. Oh my God, there'll be 1 million people going to you know, the ER because they have reflux and heartburn because they've overeaten, et cetera, et cetera. People who do that apple cider vinegar. And so as far as mushrooms and that type of thing, when you're using those types of products, basically you're going to have to use the recommended, whatever the bottle says, if you don't have any type of professional advice. When we're using it therapeutically for different types of things, you do need some level of expertise to know, you know, like how much vitamin C should you take? Today, they said you only need 90 milligrams. Well, I don't know anybody who would really be healthy if they only took 90 milligrams of vitamin C a day, knowing, especially, you know, with wrinkles and collagen, and we know that vitamin C helps, you know, collagen formation. So it's like, well, I don't think 90 milligrams of vitamin C is going to prevent people from wrinkling. It may prevent you from, you know, having scurvy, which is what it would do, where you had no vitamin C. But it's certainly not any place of health that's going on. And so, you know, it's that type of thing. So how much do you need? You know, I want to say Dr. Google may give you some guidelines per se, but in general, it's usually on the bottle of whatever it is you're buying is probably the best thing you can do. It says take 2 capsules, take 2 capsules. If it says 2 capsules twice a day, take 2 capsules twice a day. That's usually what is closest to, we'll say, RDA as you're going to get.
Awesome. Okay, great. Thank you. All right. So This question has to do with if someone could only manage to do, say, 3 or 5 reset topics. If you could narrow down to the top 5 recommendations, what would you be? What would they be? What would you start with?
That's a loaded question, because the
Right.
reality is it's like saying, if nature could separate and only do 5 things, which 5 things would Mother Nature pick? Remember, these are natural laws. These are things you're already doing. So what you're saying is, well, what's my priority? Is my priority is to, go on the computer? Is my priority to breathe today? Is my priority to drink enough water? Is my priority to drink the food that is the most nutritious for my body? Is the priority to get 7.5 to 8.5 hours of sleep? It's that type of thing. Is my priority to move my body every day? So it's like, I really can't answer that question. I do answer that question when I'm one-on-one with individuals, because we build it up, I'll say, over time in general. But it's like saying, well, so what this person may be asking, well, what about the exercise thing? Should I do a nebulizer? Is that more important than doing a castor oil pack? Is that more important than doing dry skin brushing? That really becomes on the individual person. If a person's main issue is lymphatic congestion, then I would tend to think that if you're going to do one thing, do a 30-second dry skin brushing before you get in bed. And if you want to improve it, add a castor oil pack for 20 minutes, which would be helpful. But if your main issue is brain fog and worrying about cognitive decline or chronic sinus or congestion or cold, I would say a nebulizer is something that would be, for that individual, something that's extremely essential for them to add. And normally when we recommend nebulizing, we say do a 30-day challenge, do it for 30 straight days, and then decide. And almost always when I have a patient do that for almost any problem, when they stop, they say, it's not worth stopping. This really has a beneficial aspect. And whether it's because it lowered the person's blood pressure and they went on blood pressure medicine, or their 30-year tinnitus went away, or their sinuses for the first time that they can breathe, or suddenly they don't have brain fog, or suddenly they're sleeping better, and they say, wow, what's that got to do with nebulizing? That's because the nebulizer has the effect of literally crossing that blood-brain barrier and moving the lymph, which we've only known about since the last 10 years in the brain, which seems amazing to me in general. So that may not answer the individual question, but that really has to be, that's an individual choice, and look at your specific challenges, which are the types of things that, they all help. They're all part of natural laws, and doing it one way or the other. So obviously you need sleep, you need water, you need food, you need to move. If we're going to do anything, those should be the focus, I guess.
Awesome. That was such a great answer. Very great answer. I love it. One last question here. Could you please go back and speak to what goes inside of a nebulizer?
So the main two things that we put in nebulizing, that I put in, is just saline, salt water, if you like. That's isotonic for the body. And then we routinely put in glutathione. Glutathione is a substance that's necessary in the body. I mentioned it with acetaminophen. One of the things that will basically help negate the effect, in addition to N-acetylcysteine, which basically becomes glutathione, and green tea. Glutathione is one way that you can help the body. And all this is biochemical, which I didn't get into it. It's what the liver does. It's called sulfonation. It's how the body breaks Tylenol down, acetaminophen down. And interesting, in autistic kids, they've been found they have a deficiency in their sulfonation pathways, which they think, so an autistic child given Tylenol will make their brain function even worse. But anyway, that's a whole other issue in general. So, there's the aspect of what we're looking at, how are we going to enhance everything that we're doing? How do you keep doing the 21-day reset? Which I got off topic. So ask me the question again, because
it was just what goes into the nebulizer, and we have a minute left.
Okay, so we have saline, we have glutathione. Now, what I do specifically for an individual is I will put a chemotherapy, I'll put a phytotherapy, I'll put a homeopathic remedy, or N-acetylcysteine, whatever seems the most appropriate, once again, individually. But if minimally, if you use salt water and glutathione, you'll basically be well ahead of the game. But if you're speaking with a practitioner, they'll probably put a couple of other things in there which will further enhance. They may put a remedy that's for the lymphatic system. They may put a remedy for chronic sinus problems. They may put a remedy for emotional things, etc. That becomes individual. Saline and glutathione for sure, and then the other things are a bonus.
Wonderful. All right, well, everybody, we are out of time on today's presentation of stocking your natural medicine cabinet and the questions about anything regarding the 21-day reset. So I want to say thank you to Dr. Thom for being here today, as always. Wonderful. And thanks for everybody for coming, for joining us today. Again, tomorrow you're going to get a lot of information in your inbox, compilation of all the reset information plus other bonus material. And please stay in touch with us, be in touch with us. We have an upcoming BioBites on February 7th with Rick Clarici on fixing our broken sleep. So with that, thanks everybody. We'll sign off.
Thank you, everybody. Have a good day.